If you're trying to conceive and feeling overwhelmed with fertility advice, then this podcast is for you. Welcome to Don't Tell Me to Relax, your fertility podcast and antidote to unhelpful fertility information. I'm Hannah, a fertility acupuncturist, teacher and campaigner for better fertility education. This podcast aims to empower and inform you about your menstrual cycle and fertility. It's basically all that information you didn't get in sex ed at school, with the aim of improving your understanding of your reproductive health and optimizing your fertility. Hello everybody and welcome to this episode. We are going to be talking all about egg freezing, and before I came on I actually did a little bit of research because it's actually been in the news a lot recently about egg freezing. And I saw the statistic that said that in 2019, there were 2,576 cycles. Do you call them cycles of egg freezing? And then in 2021, that had pretty much doubled to 4,215. And I would say in our clinic, we definitely are seeing more and more people who come to have support to help with their preparation before they freeze their eggs. So I thought it would be a really good episode to talk all about it, because I think there's a lot of confusion and misunderstanding out there. So I am sat with lovely Rebecca from the Evewell, and she is a patient services manager there and has also frozen her eggs. So we're going to have such a juicy conversation. Rebecca, do you want to introduce yourself and just say a little bit about your background and how you came to work at the Evewell?
Of course, Hannah. Hi, thank you for having me. So I am a midwife and a fertility nurse by background. So I joined the Evewell in 2019 as part of the nursing team. I also happened to have a business management master's. So after about 6 months, I moved over. So yes, now I'm the patient services manager at the Evewell, which is a lovely clinic to work for. So yeah, really nice.
You've got many strings to your bow and you don't look old enough.
Something like that. I think I took a bit of a roundabout route. I did the management masters to get out of healthcare, and then the Evewell convinced me to stay. So
okay. So now you're kind of like bringing it all together.
Bringing it all together for sure.
Nice. So I think it's good to probably start right at the beginning. So can you tell us what, I know this sounds like a really basic question, but what actually is egg freezing? Like what is happening? What's it all about? Like, tell me about it.
Of course. You say a basic question, but actually for lots of people, this is not their day to day. When you speak to people every day, and this is my job, it feels like everybody knows about this, but they really, really don't. So egg freezing is a form of preserving somebody's fertility. So it's a way of almost freezing time when it comes to somebody's fertility potential at the moment that they freeze eggs. And I'm not sure how much detail you want straight away, but it's basically the first stage of an IVF cycle up until the point where eggs are collected, and then they're frozen at that point and stored for as long as that person would like them to be stored within the law.
Okay. And so how, I mean, is there a recommended time of life? Like hang on, let's go back. Why do people do it, first of all? Like, because I imagine it's not only about an age thing, or you've not met somebody. There's lots of medical reasons that somebody might want to freeze the eggs. So can you explain a little bit about what might make somebody make that decision to freeze their eggs?
Yeah, so fertility potential, as I kind of like to call it, has two main factors if we're thinking about eggs. You have your ovarian reserve, so the amount of eggs that somebody has and how many eggs they might have compared to other people of their age. So when we're talking about, and we can go into this a bit more, things like AMH and the number of follicles you're seeing on a scan, that's all an indicator of someone's ovarian reserve. You then have the age-related factor. So the ability, and that's to do with the ability of eggs to go on to create a kind of a normal, healthy embryo. And there's this big red flashing light that people have in their mind about the age 35, that's just when somebody's fertility just falls off a cliff. It's not really like that. It's a much slower decline. People don't need to worry so much. But that's the kind of age where we need to start thinking about, are these eggs going to go on to create normal embryos? So to kind of come back to your question about why somebody might do that, if they have results at quite a young age that are less than you'd expect in terms of ovarian reserve, then it might be a recommendation is to freeze eggs at that point, to, like I said, pinpoint or freeze their fertility at that stage. If they're getting to the age where maybe those eggs would start to not be creating normal embryos, and they've not got any plans to have a child in the near future, either because they haven't met somebody or sometimes we're just not ready, then that might be another reason to do it. And then you've also kind of touched on there may be medical reasons not to do it, to freeze your eggs. So someone having cancer treatment, or somebody who might be wanting to undergo a transition. They're trans, they're non-binary, and they want to freeze eggs in order to be able to have their own biological child in the future. There are lots of reasons why someone might do that. And you talk about those cycles increasing. I think as this conversation goes on, which I think is really important, and as people become more aware that this is something that's available to them, I think we are going to see, and we have seen, this kind of almost exponential increase in people interested in freezing their eggs or preserving their fertility, for sure.
That's right, because I guess when it comes to fertility, if it's, you know, solely for the purposes of conceiving, then we know that age is one of the biggest factors. And so if you can do something about that at an earlier age, that really is amazing.
Yeah. And I think that we always talk at the Eve Well about just having a look at what your fertility potential is. Because I think there's a lot of talk about egg freezing and kind of selling egg freezing as something people should do. It's not something that everybody needs to do. So it's looking at your circumstances. Are you looking to conceive in the near future? Are you sure you even want to? And taking a little peek at what might be going on to see whether you're somebody that needs to do that or not.
And so how do you, let's say you're 34 and you kind of interested to find out about your fertility, because it's interesting, isn't it? There is, you know, it's so difficult to know what your fertility potential is. I guess, you know, we always talk about if you've got a good cycle, if you've got no underlying issues, you know, if that's always been the case, if your health is generally good, then you could assume that you would be okay. But really, there are still things that you could have a regular cycle and you might not know about. So how do you go around doing a full assessment of someone's fertility potential?
So we would do something called a female fertility review. So we'd be doing a couple of blood tests. We would do an anti-Müllerian hormone blood test. I mentioned that a little bit earlier, AMH blood test, which gives us a good idea of an ovarian reserve. And I'll kind of circle back to that in a second. We would do a thyroid function test, because we know that somebody's thyroid being a little bit off can throw other hormones off as well. We would do an ultrasound scan. So we'd look at somebody's uterus and ovaries in general, but if we're thinking about something like egg freezing, we'd particularly be looking at the number of follicles that we'd see in somebody's ovaries. So follicles aren't eggs; they're fluid-filled sacs that have the potential to become an egg. So in a normal month, we're talking about regular cycles and somebody ovulating. In a normal month, you would recruit one, maybe two of those follicles and grow them at the expense of all the others, and that's where you'd ovulate from. If you imagine those follicles kind of growing and ovulating as a bubbling pot of water on the stove, your AMH, your anti-Müllerian hormone, is like the fire below that pot. It's the power that your ovaries have to keep doing that. So if you lined 10 women up all of the same age, 34-year-old women all up at the same age, everyone would have different numbers of follicles, different AMH levels, but what we all have in common is that starts to go down as we get older. So what we can do is look at those results and say, yep, this is where we would expect you to be sitting at your age. What are your goals? What are you looking for? And we'd then be able to advise, okay, maybe you're not looking to conceive for another 3 or 4 years. Maybe we should think about preserving your fertility at this point. Or we might be saying to somebody, oh, this is quite a lot lower than we would expect. So we should start to think about doing something sooner rather than later. Or for another group of people, we might be saying, everything looks great. with your plans and your goals, this is exactly where we expect you to be. Unless something changes in the next couple of years, just think about coming back and having a little look again in a couple of years' time. I'm not sure if that answered your question.
Yeah, absolutely, it does. And in terms of, you know, the question about AMH, because it comes up a lot in the, you know, we often have people who come to us and they're like, I've got really low AMH, I need to go for IVF. And there's a lot of this kind of conversation around AMH, and it's, you know, can you conceive with a low AMH naturally, and all of that kind of conversation.
Yeah,
obviously
great.
Studies show you can, but I guess what you're talking about here is something quite different, because AMH correlates to the number of eggs that you would potentially collect if you were to do egg collection.
Absolutely. So I also have that. I get lots of calls. I take, you know, calls from our new inquiries, and I get people very, very stressed that they've had a low AMH result. If somebody is ovulating every month, then obviously there's lots of different fertility issues. Low ovarian reserve is only just one. So if somebody is ovulating every month, they have exactly the same chance of anybody else that's their age as conceiving. What AMH is looking at is, like I said, the ability of your ovaries to keep doing that. So it's really relevant for people who are thinking that they want to delay conception in some way. For somebody who already knows they need fertility treatment, as a way of indicating exactly what you said, how many eggs are we going to collect in a cycle, depending on what their goals are for their family, how many cycles of treatment does that mean that we think that they would need. AMH is not an indicator of somebody's ability to conceive naturally, and I think that's a really, really important point. One of my colleagues always tells the story about how, as fertility nurses, you're sitting there in a clinic, so everyone goes and like does their AMH, and then someone's will come back as low, and then they'll rush home and say to their partner, we need to start trying straight away, and they'll get pregnant immediately, and their partner's like, you told me this was going to take years and be really, really hard. And it's not AMH is not looking at your ability to conceive there and then. It's definitely talking about future potential.
And I guess AMH and the follicle count will give you an idea of how many eggs, or, you know, how many follicles would be stimulated across a cycle, and how many eggs you would collect. So in terms of numbers, because we've had a few people recently through clinic who've been doing this 3-cycle package. They've been doing back-to-back cycles, one after the other, to collect as many eggs as possible. And is there like a magic number of, if you've got 20 eggs in the freezer, then from that you can feel, you know, you can kind of rest a little bit and feel like that's okay, that's enough? I mean, I'm asking loads of different questions now, because the other thing is that although you've got eggs in the freezer, you don't know about the quality, do you?
Yeah, no, absolutely. So is there a magic number? Not one that can be applied across the board to everybody.
Yeah.
So this is where we talk about that age-related factor coming in that as you get older, the proportion of eggs that are going to go on to create normal embryos goes down. And if we're freezing at the point of an egg, you're right, we don't know, looking at that egg, whether that's going to create a normal embryo or not. So the doctors can do some quite, they've got studies to do some quite nifty calculations that says, if you're this age, if you're 30, this is how many eggs we'd want you to have in the bank to have an 80% chance of having a live birth in the future.
Right.
Again, that's where I really harp on about somebody's goals, because what we don't want is somebody walking out of the building aged 30 thinking, I'm not having a child for 10 years, I've got enough eggs, I've got 20 eggs in the bank and that's fine, and I want to have a family of 5. So this is where it kind of comes in of saying, like, what is your vision for your future? What are your results? What number of eggs do we think we can get in one cycle? And therefore, how many cycles of treatment do you think we need? And not everybody is going to need 3 cycles to achieve that. So we definitely take it from a very step-by-step way. This is what we think we're going to get. Bodies aren't textbooks, so we want to review again at the end of the cycle. Did we meet our goals? And then go on to the next cycle if that's necessary.
Yeah. So I guess do you do packages at the Evewell, or do you generally do cycle by cycle and see how people go?
We do cycle by cycle to see how people go, because I know, for example, if I tell my story a little bit, I found out at 25 that my AMH was below the 25th centile. I was working in a fertility clinic and I kind of did a little bit of a blasé AMH test. And I looked at my partner at the time for like one night and thought, are we going to have a baby? And I thought, no, we are not. And I kind of kicked it down the line until literally April this year, when I tested my AMH a few more times and thought, oh, okay, this really is low. And now's the time to do it if I'm going to do it. And I tried to keep my expectations really, really realistic. I thought I'm going to need 3 cycles for sure, at least, to get the number of eggs that they're saying, and was kind of beating myself up for not doing it earlier. And actually, like I said, bodies aren't textbooks. My response to treatment was fantastic, and I know not everybody's is, but it really was. And I got the number of eggs in 1 cycle that I was expecting to get in 3. Wow. And I think that's where, as clinics, we have to be really careful. I think I was exactly the person that would have signed up for a 3 cycle package on day 1 and paid for it. Even with all of my knowledge, I thought definitely going to need 3, and I didn't. So I think it's really important to have that conversation, take it step by step, review at the end of every cycle, and take it from there, really.
Yeah, that's really, really good point. And also, I don't know, I guess there's, some people feel like if their AMH is low, that there is this real rush to kind of crack on and sort of back to cycles. But it's grueling doing 3 back to back.
It's pretty grueling doing 1.
Yeah.
If I'm honest with you, I think I watched these incredibly, like my whole fertility career, I've watched these incredibly strong women come in and semi-breeze back out again. And I like, I have my patients crying on the phone. I know that fertility treatment is not a breeze, but I just watched these women shoulder this treatment. And I definitely don't want to scare anybody. It wasn't horrible by any stretch of the imagination, but I really underestimated it, despite it being my job. 3 cycles back to back would be hard. Yeah.
And what age is the average age then that people come to your clinic for treatment for egg freezing?
So it's definitely getting younger. Right. And I think it's getting younger because, and this is great actually, because the HFEA have changed, or the government have changed the law recently. So it used to be that you could only freeze eggs for 10 years and then you had to do something with them. You either had to fertilize and create embryos and freeze again, or you had to discard them. The law changed, I think, last July to be 55 years that you could freeze for.
Oh, wow.
So that means that suddenly options open up, right? So one of the reasons that at 25, when I found out my AMH was low, I didn't go straight ahead to freeze eggs was because I was like, am I going to be ready by 35 to use them?
Yeah.
Probably not. So I had to have this balancing act. And actually, this is a really good point, that I had to do this balancing act between, I know my AMH might go down and therefore I might need more treatment to receive the results that I need. But at the same time, I need to think about that end point of when I'm ready to use them. So actually, the law changing stops women having to do that balancing act as well, which I think is great, really.
I wonder why they had that law there in the first place. I wonder what the sense was behind it, because it doesn't actually make any sense, does it, when you think about it?
I think fertility treatment is such a highly regulated industry, which it should be. It really, really should be. But I think that leads to some kind of some laws that maybe are around what age should women be using these eggs and things like that kind of curtail how long we can store for. But it's great that they've opened that up, and that means that, like I said, younger women can come through for treatment if they feel like that's what they want to do. So we do notice it dropping. I guess to answer your question more directly, I have probably 2 groups of women coming through. I have those who are in their late 20s and maybe have heard about it from their friends and are being really trying to be really proactive with that. I probably have a group of women who are more like 34 to 36 who are then thinking about the other end of that spectrum. They're not ready to have a child yet, or they're not in a position to, and they're thinking, let's try and address this before that kind of scary 35 number comes up.
It's a big number, isn't it? It's a number that's kind of bandied around a lot, isn't it?
And lots of scaremongering around it, and it's really not that.
Yeah. And in terms of like preparation for freezing, like what did you do? What was your kind of approach to it? Because obviously people come to us now sort of wanting to get support through their nutrition, wanting to kind of, work on all the lifestyle stuff, wanting kind of stress support, sleeping better, all of those kind of things. Do you see a value in that? What did you do before you went?
There is definitely a value in that. Your clients may be more disciplined than me, so I may not be the best advocate for a healthy lifestyle prior to egg freezing. I always used to say in my nurse consultations when I spoke to patients that definitely, as a bare minimum, try not to be drinking coffee during your egg freezing cycle, trying to be eating healthy. And I always used to say, if that's going to be really stressful for you, because stress also plays a factor in results, start to ease back on that as soon as you can, so that those 2 weeks aren't suddenly this massive stress of cutting everything out. And I am so glad that I took my own advice, because I found it so hard to stop drinking. I thought, it's fine, I drink 2 coffees a day, I'll be fine. So I think if I was doing this again is the right question to ask me, Hannah. If I was doing this again, I probably would start a couple of months earlier and try and get all of my healthy habits in line before. There is definitely a value to it, for sure. My clinic also gave me some supplements to take for a month before I started. So there's definitely a value to it, and there's also a value, I think, from a mindset point of view of taking some time to get into that headspace. I think it's great to do these things as a combination with your consultant, your fertility doctor, because the only caveat to that I'd have is there will be a group of patients for whom the positive benefits of that preparation would be outweighed by the kind of drop in their results that might happen over that time. So I always say to people, like when people call me on the phone, they say, should I do this for 3 months before I start? I usually say to them, come in and get your investigations done first, and then have that discussion with your doctor. And then they can say, yes, go away for 3 to 6 months and then come back when you're feeling like in tip top condition.
It's really good advice. And so let's go to like the other side of this. So let's say you've frozen your eggs. And let's say you've frozen your eggs because you haven't met somebody yet, and then you meet somebody, let's say, I don't know, you're 40 or something, and you have your frozen eggs. Like what happens then? You decide you're gonna, well, maybe you've been trying naturally and it's not happened. So you're with your partner, you've been trying naturally, it's not happened. And so you think, okay, I've got these eggs.
Let's use them.
Or maybe you decide you're financially viable and you're going to go solo. So maybe you're going to use a donor. Like, there's lots of different scenarios. What are the next steps?
I love that you're asking me this question, Hannah, because I think that this is actually something that people don't talk about and don't really think about. So I mentioned at the beginning that egg freezing is like the first section of IVF. So it's that stimulation of the ovaries and then the egg collection, and then we freeze the eggs and we stop. So when somebody's ready to use those eggs, like you say, with a partner, with a donor, we have to complete the process. So we would thaw those eggs, and generally with the freezing technique that we use now in comparison to 10 years ago, the results from those thawed eggs are really good. So at the Eve Well, eggs that we have frozen and then thawed ourselves have over a 95% thaw rate, which is fantastic. So we thaw the eggs, we would fertilize them. We have to use a procedure called ICSI when we are fertilizing thawed eggs. So ICSI is what you see on the TV, on the news, when they talk about IVF, that kind of image of a sperm being injected into the egg. That is ICSI. And then we get those embryos to develop, so usually until day 5. at that point, and usually we would do that with a whole group of eggs. It wouldn't just be thawing one egg and fertilizing and trying to get that one to the blastocyst stage, mainly because we know there's going to be a drop off. We know that there is going to be a number of eggs that don't fertilize and that don't make it to the embryo stage. So it's more cost effective to do a group of them, if not all of them. At that point, when we know how many embryos we've got, if somebody does want to transfer one straight away to try and get pregnant, we would put one back and then we would freeze the rest, and then the rest can stay in the freezer just like the eggs did as well. So if for whatever reason that first transfer doesn't work, or somebody wants to come back for baby number 2, those embryos are there and ready for use as well. So I think it's a really good point, because I think people think of the kind of funnel from, let's say, I'm going to pull a number out of the air here, like 20 eggs down to 6 embryos, feels like this massive drop off and like something's gone wrong. It's actually the other way around. That's exactly why at the beginning we're saying to somebody, we want an 80% chance of one kind of live birth, then we are going to make sure we freeze this number of eggs to account for all of those stages that we know there might be a reduction in the numbers. Does that kind of make sense? That's why we're freezing that number at the beginning.
Yeah, exactly. And I guess that number really is dependent on age, AMH, all of those things. So you can't really give.
It's why I'm avoiding giving you a magic number.
Yeah.
That's exactly why, because it is definitely something that the doctor will say based on their goals, a realistic expectation based on their AMH and how old you are. So therefore, how many are going to go on to create good embryos.
And it's always that thing, isn't it, that, you can be very kind of, it's all about the numbers. It's all about the numbers. And I get that. I totally understand that. But also, as we've said before, you don't know about the quality. You don't know about the quality. So perhaps if your numbers aren't where you think they might need to be, there's still room, there's still opportunity for it to be successful, because
absolutely,
if you've got 10, then you're looking for that one, then there is still huge potential in that 10.
Yeah. And I don't want to fall into that fertility cliche of saying it only kind of takes one. But that's exactly what an experienced clinic and consultant are trying to scale up for you. They know how many you need to try and get that one. And especially when you're coming through the door nice and early, which is what, my encouragement always is, to just have a little look at your fertility potential and see what's going on. This group of patients are coming through nice and early where they can make those kind of choices, as opposed to some of our patients that might be a little bit older and have been trying to conceive for a long time, and some of those choices in terms of numbers just aren't there for them anymore.
Yeah. And can I ask, just going back, why ICSI with a defrosted egg?
I'm not an embryologist, so my lab director might shout at me if I get this wrong. But I think it's because
already, so I can't ask her.
I know. I believe, and Emma can mark my test. I believe it's because to freeze the eggs, you have to strip them.
Yeah.
And once I'm almost sure I'm right on this. And once you've stripped them, IVF doesn't work, but I can't tell you the science any more than that. I'm sorry. But I'm pretty sure it's to do with stripping the eggs. The process of freezing means that in order to fertilize those eggs, you have to use an ICSI technique instead.
And then once they're fertilized and they've become embryos, then they can go back in the freezer.
Yes.
So the double freezing isn't an issue in terms of its impact on the quality.
No. And the other really nice stat that we have at the Eve Well is that I think is really relevant is once those eggs have survived the thaw, our results are showing that those frozen eggs behave the same way as a fresh egg would in terms of the numbers that fertilize and the numbers that get to blastocyst stage. So those, other than that small percentage that drop off at the end of like a thawing process, you're not losing anything by freezing at that point. And then again, the freezing techniques of embryos are so good that we know success rates with fresh and frozen embryos are comparable as well. So a good lab will get you good results.
And are you seeing now, I think, because I was just thinking about it, I've only had one person through our clinic who has reached that point in their life where, you know, they'd frozen their eggs a few years ago and now they were at the point where they were going to use them. That's the first person, because most people we see are at the freezing stage and not yet at the using them stage. And I guess because it's, you know, there's been such an increase in it, I guess over the next 5 years that's going to become something we see more often, is that people are then at that stage where they're ready to use them.
Yeah, so it's really interesting. One of the criticisms out there about egg freezing is that actually not that many babies are being born from frozen eggs. And I think that's being shown to mean that maybe this isn't a very successful treatment. I don't know that that's true. I think it's exactly what you've just touched on, in that the point of this, of freezing eggs, is actually often to delay conception. So those people that are coming back to use those eggs may not come through for 8 to 10 years. And also it's trying to preserve some options for the future that you may not need to use. So therefore there will be a whole group of patients that are very happy that they froze their eggs so that they had a little bit of peace of mind, but don't ever need to use them, because as we said, if you're ovulating, you know, there's a good chance that you can conceive. So the number of babies born, I don't know if is a good indicator of the success of the treatment, because of all of those factors. Plus, eggs that were being thawed a couple of years ago that had been frozen 10 years before were with an old technique that wasn't that great. So we're now looking at this new group of women that are coming through freezing that we probably don't have a really good idea of how many of them will actually come back to use them for another 5 to 10 years.
Yeah. It will be interesting to see, won't it? Because I guess given there's been this huge rise, it will be interesting to see how that plays forward in the future.
Yeah, exactly. I mean, I think we can be reassured definitely by the eggs that we are thawing out, that the success rates are great. It's just that huge body of evidence won't be there until a large enough proportion of women have come and used them.
Yeah. So how was the process for you then? You said it was harder than you thought it was going to be.
So I think I'm super privileged in the fact that I did not have to contend with any of the logistics that most of our patients do, in terms of when it was time for my scan, I ran down one flight of stairs and I saw my colleague that I'd worked with, you know, one of my best friends did my scan. So I really want to acknowledge that it was definitely a breeze, and I work for a great place that looked after me really, really well. I think that, and again, needles don't bother me, so injecting every day didn't bother me. I think that those hormones are wild. And yeah, but it was fine. It was fine, and I'm really, really pleased they did it, and the results that I got were great, and it gives you that kind of sense of security. I'm not sure that I want to have children, but I knew that if I did, it definitely wasn't going to be for another, I'd love another 10 years, maybe. Maybe I won't get that, but you know, another 10 years. So it was definitely something that I knew that if I wanted to keep those options open, I needed to do. And maybe I'll do one more cycle. Maybe I'll come and see you before I do that.
Come and have some acupuncture beforehand.
Get some acupuncture and and see. And maybe that would also help with some of the feeling unbalanced part of that egg freezing process. But honestly, I think a lot of people are very daunted by the number of injections that you have to do, because egg freezing, like I said, first stage of IVF, all of those kind of follicle stimulating hormone injections, actually what I had been telling patients for years, that mixing up the medication is truly the hardest part. Once you've got over the anticipation of that first injection, that they're not too bad. That tracks. It was really interesting doing this, having talked people through it for years, to go, how much of the advice that I've given and the tips that I've given actually work. I always would say to people, if I am talking rubbish, please come back and tell me, because I tell patients, this is how you're going to feel. You're going to feel similar to how you do at that stage of your cycle, but to a greater degree. So it was very interesting getting that feedback myself, that I haven't been giving people terrible information this whole time.
With your knowledge, what would you say to people if they were thinking about sort of freezing? Where would you say, or what would you recommend for them in terms of what should they do? How do they choose a clinic? How do they make sure that they've been properly checked?
I really feel like you need to go with a clinic that is going to give you a full breadth of information. They should be giving you a balanced view of exactly what they think your fertility potential is and how quickly you should move on freezing your eggs. I don't think you should ever feel really rushed into doing that, or that you are being sold something.
Yeah.
This is a medical process, and again, I'm not trying to be doom and gloom about it. It's not that. It's fantastic that it's accessible and it can be made to feel really, supportive and nice. But it's definitely something that you want to make sure that you trust the people doing it. It's a medical procedure. Trust the clinic that's doing it. Make sure that you feel supported by them, that you feel like you have all of the information to be able to make a really informed choice. And in terms of how to make sure you've been properly checked, I mean, the test that I mentioned at the beginning, an AMH blood test and a scan and a really good consultation with an experienced doctor in clinic can give you a really comprehensive view. And yeah, go with your gut is what I would say. Go with someone that makes you feel comfortable.
Yeah, because you want somebody to be asking you, as well as, I am actually going to do an episode about fertility MOTs, because sometimes they're a bit basic, like if it's an AMH and a transvaginal scan, I sort of feel like, from what we spend an hour with a person asking questions about many, 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 many different things, because that enables us to give us a good understanding of their health, which kind of is which is then like, fertility and health are like interlinked, aren't they? So I sort of feel like that sort of whole approach of looking at that person who's sitting in front of you and what they're doing with their life, how they're sleeping, what their stress levels are like, is a part of the assessment, I feel.
I completely agree with you, and I think that consultation element is a really, really key point. And I know that there's lots of routes at the moment to be able to get this AMH blood test done. There are lots of routes, and I think that I would always encourage somebody to be doing that somewhere where somebody is going to sit you down and explain what this means. Because if somebody gets a result back that, I don't know, if at 25, if you just get a 9 and you don't know what that means and you don't have that opportunity to discuss it. Again, I was super privileged. The clinic that I worked at, I went and spoke to 3 different consultants and got their view because I had the ability to do that. They were my colleagues. So yeah, definitely you're right. That consultation part of that, someone's taking the time to go through your medical history. And I'm going to say again, your goals for the future.
Yeah.
Because that absolutely changes what a clinic's recommendation would be. If somebody comes in at 28 and they have a great AMH and they have a partner and they say, we're probably going to have a baby in 2 years' time, do they need to be sold an egg freezing package? Probably not.
Yeah. Yeah. Well, I mean, I was just thinking then, wouldn't it be amazing if, like, I don't know, every like 2 years in your life, you have a check-in with somebody like a nurse, or I don't know, somebody who goes, okay, let's have a look. Let's have a look at your menstrual cycle, your contraception, your vaginal health. Maybe we'll test your AMH. We'll do a transvaginal scan. We'll look at your life, and we'll have a chat about your fertility and your sort of your general hormonal health, because it plays such a huge part of not just, your reproduction, but also, your monthly cycle, what contraception you're on, and then, going into perimenopause, menopause. If your cycles are always messed up, then you are going to go through perimenopause in a completely different way than somebody who understands their cycle, who has a good cycle, because those hormones are already imbalanced and off kilter. So when you hit perimenopause, it's highly likely it's going to be even worse. So just that kind of like education, I don't know, I reckon every 2 years is probably a good amount of time, and just say, right, let's check in with it all. And then people can sit there and they'll go, okay, I know what it is that I need to do. Now is not the time. I'm cracking on with how I am right now.
Exactly. I sat in an event the other day, a kind of gynae health event for women in their kind of 20s and 30s, and the amount of frustration in that room that we actually were all experiencing similar symptoms that aren't quite in the realms of normal, and there's just not really that knowledge or expertise, or like you said, holistic look at what's going on. I think when it comes to fertility specifically, it's such a silent thing. We touched on this earlier. If you had a sore ankle and you'd been walking around on your sore ankle for 6 weeks, you'd probably go and see someone and just get it checked out. But fertility is one of those things that you don't know if anything's wrong until you have a little look. So I completely agree. Again, it's not about scaring people. It's just saying, get this extra piece of information about your health so that you can make a really informed decision about whether you want to or need to do anything about it. Yeah.
How can we make that happen? How can we make that be the norm in the world?
We team up, Hannah, and we provide it.
It would be amazing, wouldn't it? I mean, it also, I can't imagine it would actually be that difficult or that costly, to have a sort of check-in, have a scan, have a blood test, and think about how much it would save in the future, where people have, like, they've found out there's an issue, so they've done something sooner, so they're not then kind of
preventative rather than like reactive. I haven't fact checked this, but there was a stat at this event that was saying that only 2% of the research budget goes into women's health in the UK. And apparently we're like leaders in Europe, so like in other countries it's like 0.06% or something. And I think that's why, I think that answers the question as to why this isn't available, because if people think that having really painful periods and really heavy periods is just something that you just got to grit your teeth and get on with, and oh well.
Yes, well, let's start the revolution.
Let's change it. Yeah, exactly.
Oh, Rebecca, thank you so much for talking to me, and thanks for sharing your story as well. It's really interesting to hear from both sides.
Yeah, it was really interesting for me to go from that work side to that patient side. It was really fascinating, and I feel like I'm kind of the exact person of just saying, just have a little look, because I didn't do anything about it for 5 years. It doesn't, I think people are very scared about what does this mean? What am I going to have to do? And actually you can sit with it and you can think about it, and it doesn't mean that you have to do anything with it, but at least I feel like I knew, okay, you can give yourself 5 years to think about this, and you can just keep checking in every couple of years until you reach the point where you think that you want to do something about it. So yeah.
Okay, well, thank you very much for your time. As always, I'll put all the notes on the podcast when it's released, and I look forward to doing it again. We need to do another one. We'll do one about, I don't know, starting the revolution or something like that.
I know, we should, shouldn't we? I love it. Thank you so much, Hannah.
All right, take care. If you've enjoyed listening to this and want to find out more, then come and join my free community in Facebook. We have loads of resources. You can catch up on all our previous webinars and be the first to know about forthcoming events. To sign up, just follow the link in the show notes. And if you'd like to work one-to-one with myself or one of the team, then please see our website, hannahpern.com, where you can book in directly or organise a discovery call to find out how we can support your fertility and your reproductive health.